Ojan. I am one of the students at Okun State University, Department of Nursing, and I am a first semester student of the Doctor of Nursing program. Today I'll be talking to you about the framework as developed by the CDC for quality improvement projects. This framework was developed in 1999, and the purpose was twofold. Number one, it was to help summarize and organize the basic elements of a quality improvement project. Number two was to help guide healthcare professionals in the systematic planning and execution of quality improvement projects within the healthcare system. Now let's go back and define quality. Quality in healthcare is very broad. In essence, it has 6 basic aspects. Number one is safety. Number two is effectiveness. There is also patient-centeredness, timeliness, efficiency, and equity. Now let's try to describe these aspects of quality. Safety has to do with making sure that whatever improvement project we are carrying out, whatever care that we are giving to patients is safe. Of course, as healthcare professionals, we know our first oath is to do no harm. Effectiveness is to make sure that we are giving the correct treatments for the correct purpose. We don't want to give medications for cholesterol to somebody with blood pressure, and we don't want to give the wrong treatment for the right purpose. Patient-centeredness has to do with making sure that the patient is at the center of everything we do. There is a saying I heard from someone a while ago that says, "Nothing about me without me." Therefore, the patient has to be involved in their care and making sure that everything we do has the patient in mind. We have to take into consideration the needs of the patient. We also want to make sure that the expectations of the patients are taken into consideration. And how can we bring these together to give the patient the best possible care and outcomes? Timeliness has to make sure we give patients care in a timely manner. We all know that delay in care has in many cases resulted in increased morbidity and, sadly enough, in some cases mortality. Efficiency has to do with cost. The United States is the most expensive country in the developed world when it comes to healthcare costs. And sometimes this cost does not necessarily translate in the best quality of care. Efficiency here has to deal with making sure that we give the best quality of care, but also at the cheapest possible rate. Equity has to do with equitable healthcare to make sure that your socioeconomic standards, the reality of the patient socioeconomically, does not determine the quality of care that they receive. We just finished a paper in another subject which showed that being born Latino in the United States during COVID-19 gave them an increased risk of infection and also an increased risk of death. There was another study that came out of Baltimore a few years back that showed that being born a black male in inner city Baltimore automatically gave you a 7-year decrease in life expectancy in relation to a white child born in similar circumstances. So we are trying in this case to make sure that we decrease those aspects that will decrease the quality of care that patients receive based on their socioeconomic realities. Now, if we have to go back to the framework as developed by the CDC for quality improvement projects, you will see that the framework has 6 basic aspects. These aspects include to engage stakeholders, to describe the program, to focus on the evaluation, to gather credible evidence, to ensure to justify conclusions as number 5, and number 6, to ensure the use and to share the lessons learned within the project. They also developed 4 standards. These standards included utility, feasibility, propriety, and also accuracy. I did a basic chart, which is right behind me, to show the basic aspects of the framework as was developed by the CDC. And we are going to go into this in more detail. In step 1, we have to engage the stakeholders. This is an important stage in bringing everybody who is involved, not only in the execution, but also in the use of the information and results that will be developed by the improvement project. This makes it easier for everybody to adopt the improvement project, but also to be able to use the information and results that will come from the improvement project. In defining stakeholders, they include the staff, the managers, the sponsors. They also include communities and patients, but also sponsors. In step 2, you have to be able to describe the program. You want to know what the scope of your program is. Does the program have any capacity to create change? Does it fit into the larger community within which it is being evaluated? Other aspects to be covered by the project must include the need of the program, the expected effects. What are the activities of the program? The resources of the program. With resources here, we are talking about human capital, the staff, the nurses. We are also looking at the software and hardware. We are looking at the stage of the development program. Is it a new program or is it an old program? Of course, we know that a young program, which is 1 month old, is going to be managed in a different manner as a program that is 5 years old. What is the context of the program? In step 3, we are looking at focusing in the evaluation of the design. Here we must address the needs of the stakeholders. Amongst other things, we must also make sure that the purpose is well defined, that the users are known. What is the information going to be used for? What questions are we trying to answer? What methods in collecting information and carrying out this improvement project are we going to use? Do we need agreements between stakeholders and end users? Having a specific purpose is going to help prevent premature decision making. It will also help to affect the appropriate change that we are looking for and assess side effects. But also it will be good in using the process of equity to affect those who participate in the program. In step 4, we want to gather credible evidence. We want to make sure that this is a well-rounded information, that it is free of bias, and that it is believable, and that it answers the questions that we are trying to answer to help improve the system we are trying to evaluate. In step 5, we must be able to justify our conclusions. We must remember that the conclusions must be linked to the questions that were agreed upon in step number 3. We must make sure that the values and standards that were developed are also taken into consideration. In step number 6, which is the last step, we want to make sure that the conclusions that came out of the improvement project go into the right hands, and also that they are used in the appropriate manner. Now, those are the 6 basic aspects of the framework. And we are going to be talking now about the standards that were developed by the CDC. The purpose of the standards was to help assess the quality of the evaluation activities. I must remind you that this is not something that you do once or at a particular step, but as the improvement project is continuing At every stage, you must use these standards to make sure that you are on track and you are doing what you are supposed to do. And the standards, like we talked about, included utility, feasibility, propriety, and accuracy. Utility has to make sure that all of the information needs of the project is satisfied. Is the information the right amount? How are you going to collect them? What are your findings going to be, and how are they going to be evaluated? You also want to make sure that that information in terms of the report is delivered in a timely manner. Feasibility has to make sure that the project is viable, that it is sensible, and it is realistic in very practical ways. Propriety has to do with ethics. You want to make sure that the ethical needs of the stakeholders are maintained. Accuracy has to make sure that whatever result you produce are considered to be correct, that the methods used in the evaluation are transparent and are valid. Now, ladies and gentlemen, this is a summary of the framework as developed by the CDC in 1999. Thank you very much for listening. I am Peter Ojon, first semester student of the Doctor of Nursing program at Alcorn State University in Mississippi.